Dr. Charles Moak with Allure Medical Spa and Michigan Cosmetic Surgery. So I want to talk to you about breast implants and the newer materials available, go through the history a little bit and why they've changed. So for the past, let's say 1993 to 2006, we're using these saline implants. These are approved by the FDA, and basically there's water put in them. This is not completely filled, but they fill up with water. They go in like a little, say, sandwiched up. We fill them up with water, then take a fill tube out, which was nice that it had the ability to make a small incision. The downside is when you fill them, you have to overfill them with water or they would wrinkle. And even when you overfill them with water, they kind of wrinkle on the edge. We call it scalloping, and they are kind of hard. So saline implants kind of fell out of favor when they brought in the new generation, the latest generation in 2006 of silicone implants. Now the first silicone implants that were on the market years ago had some problems with leaking, and over time the outside wall would break and the silicone would leak out. So they made silicone gels that the silicone was kind of stuck together. That way if it got damaged, the silicone would just kind of stay right near the implant. And the inherent problems with them is they wrinkled a lot. You can see when you put it on its edge, this really gets a lot of grooves and wrinkling. And we compensate for that by placing it under the muscle. So we place it under the muscle, it would push the bottom out and squish the top. Okay? So that would allow us to get the wrinkles out underneath the muscle. The downside with underneath the muscle is that the surgery hurts a little bit more and there's more pain afterwards. And also when you move your muscles around, the implants move, but we live with that because that was the acceptable solution. So then Allure and Natrelle came out with a newer implant called the Inspira. These implants are all different sizes, don't focus on that. The Inspira was a similar gel, but it didn't wrinkle as much. They basically filled it with more silicone so it had less wrinkling. And that overcame some of it, but we still would tend to put them on a muscle because of the wrinkling. Now recently, they came out with what's called form-stable gels. And a form-stable gel is one that won't deflate. So the original shaped implants were this kind of material, but if you put them on their end, you can see it would just turn into a little flat thing. So the implants would distort. If you put it on the muscle, it'll push it out a little bit, but in reality they would distort. The newer implants, which people call the gummy bear implant, and this is the gummy bear implant. A lot of people refer to these being gummy bear. The term was coined by Dr. Grant Stevens down in California, and he was referring to these ones here. And these implants, when you put it on their end, they don't distort, unlike these that wrinkle. Okay? So these implants hold their shape. Additionally, the implants are tapered. So with this implant, we put it underneath the muscle, which tapers it, and the muscle smashes the top to push the bottom out. But these implants are naturally tapered, so they eliminate the need to have to put them underneath the muscle. And eliminating putting them underneath the muscle means that it hurts less for surgery, and it hurts less after surgery, much less pain because you're not interrupting muscle, there's less bleeding during surgery. The recovery is quicker, and they don't move around when you move your muscles around. Additionally, they still look natural. In fact, they look more natural because they're tapered like the shape of a normal breast, whereas these are round on top. Okay? So these give you a more natural look. The other thing is that when we hold these two implants up here, in this case, the implant is placed exactly underneath the nipple, so the nipple goes right in the middle. On this implant, it has these two little dots here. I don't know if you can see them, but two little dots, and the nipple goes right there. So in this case, the implant would be sitting right here, and this one would have to be sitting down lower. Putting it down lower allowed us to get the implant underneath the nipple, but also it created sometimes what we call a double bubble, where you can see the old bottom of your breast, and sometimes they'd even slide down, where these, we fixate them right at the bottom of your breast naturally, put a suture in there so it can't slide down so they don't move. So it has the advantage of feeling the same squishiness, much softer than saline, has the advantage of not wrinkling and being able to hold a natural form. Now you notice the color looks a little bit different, okay? Well, this is called a macro textured surface, and the texture is designed to reduce a complication called capsule contracture. Capsule contracture is where your body makes too much scar around the implant and one breast, or maybe both, gets hard and maybe distorts the breast a little bit. But the texture reduces that capsule contracture rate. So why didn't we put the texture on these implants? Well, if you put the texture on these implants, they would wrinkle even more. The texture led to more wrinkling, so they weren't really acceptable for breast augmentation in many cases. Some women could use it because they have enough tissue, but in this case here, since they don't wrinkle anyways, has the product advantage of they don't wrinkle, at least not nearly as much. They have texture, so they'll encapsulate less. They sit higher in your body, and women want higher breasts. and they look more like a natural breast, and they maintain the feel of silicone, unlike saline. So these are the new shaped Natrelle Gummy Bear form stable implants. Form stable means they don't distort. And these are the next wave of breast implants. They became fully available in, I think, October, November of 2016. So thank you very much, and we're going to go on and talk some other features about implants. Thank you.